The video has been copied from www.redrounds.com with permission. The actual video, which is of a CT scan of chest, contrast enhanced CT scan of chest, did not contain any voice dubbing, so I would like to use this video to describe the anatomical structures as they are seen through the axial slices. So the first slice is at the level of Xiphi sternum here, at the level of diaphragm, and we will be moving up towards the neck. So this is the anterior aspect or the front side of the patient. This is the posterior side of the patient. This is the lateral left lateral aspect and the right lateral side. The rule of thumb is when you're looking at an x-ray, the patient's left side should be on your right hand side and the patient's right side should be on your left hand side, as if the patient is standing in front of you. If this patient is supine, is lying down on a table here, and you are looking from the feet end of the patient, so the rule is still followed. The right side is towards the left hand side and the left side is towards the right hand side. Anyway, so these are ribs, this is skin, and below the skin you can see fat. This is liver. The black shadows here are lungs. This is esophagus. This is a spleen here. This is diaphragmatic muscle here. This is left lung. This is vertebra here. We'll move up slowly. You're beginning to see contrast. The contrast is an iodine compound that is injected into a vein, and the contrast eventually ends up in right atrium. From right atrium it goes to right ventricle, and the pulmonary artery from right ventricle pushes the blood into lungs, where the oxygen is absorbed into the blood. The contrast is being diluted in blood, and then eventually it ends up in left atrium, and from left atrium it goes to left ventricle. So the density of the contrast will be higher in right ventricle as compared to the left ventricle, because when it comes to left ventricle, it has already been diluted with blood in lungs. There is some degree of dilution in right ventricle, but it is more diluted in left ventricle, and we'll see that in a minute. So we'll move further up. The right ventricle is very bright because of the presence of concentrated contrast. You're beginning to see the left ventricle here, esophagus, descending aorta. Some liver is still visible through the diaphragm. Okay, now you're beginning to see the contrast in left ventricle here. This is septum. Heart lies oblique in the thoracic cavity, not straight. So this is myocardium, the left-sided myocardium. The walls are quite thick, as you know, as compared to the right side of the heart, which is normal. Okay, so going up. Now this is left atrium. You can see valve here. The contrast in left ventricle is diluted as compared to the right ventricle here. Okay, so this is right atrium somewhere here. The left ventricle will eventually give rise to aorta somewhere here. This is left atrium again. These lines and these dots are pulmonary vessels. Either they're branches of pulmonary artery or pulmonary veins. So moving up, you can see a pulmonary vein draining oxygenated blood that has got contrast in it, of course, into the left atrium from the right lung here. Aorta, the root of aorta. If you notice, you can actually see the aortic valve here. The pulmonary artery, beginning of pulmonary artery here. Okay, you You can clearly see aortic valve here, these lines. Pulmonary vein from left lung draining into left atrium, descending aorta. This will become ascending aorta very soon. Okay, so few more branches draining oxygenated blood into left atrium. Now this is a filling defect here. This is a branch of pulmonary artery or right pulmonary artery. It should have contrast in it, the contrast should be as bright as here, but you can see a filling defect, which is a blood clot. This is a case of pulmonary embolism. You can still see a clot here. This is contrast. So we'll move further up. You can still see a clot here. This is main pulmonary trunk. Okay, clot is still visible here. You can see a clot here as well in the left pulmonary artery, branch of left pulmonary artery. The main pulmonary trunk giving off right pulmonary artery, you can see the blood clot here. The clot is also visible here. Okay, this is a very big clot. Okay, going into both pulmonary arteries. The filling defect is also visible here. Okay, ascending aorta and descending aorta will join together. If we go further up, this is trachea. So this is arch of aorta now, and thank you very much.